Hello, everyone. I'm Lila Sauna, Director for the Middlesex County Office of Aging and Disabled Services, and I'm joined by Jamie Mortellaro, Division Manager of Outreach and Events. It is our pleasure to welcome you to this year's 2021 Senior Health and Fitness Virtual Seminar. We are so glad that you're able to join us for this seminar that we've put together and hope that you'll find the presentations educational, interesting, fun, and most importantly, useful and meaningful that you can also incorporate into your everyday life. As many of you are aware, we traditionally hold our in-person annual Senior Health and Fitness Walk in September to recognize Healthy Aging Month. We get together at Roosevelt Park in Edison, where we can all meet for an active, fun-filled day of walking, learning, talking, having lunch, and taking advantage of the outdoors and the beautiful park and recreation that Roosevelt Park has to offer. We work very closely with your local Office on Aging and Senior Centers for this event, and we would also like to thank the continued support of the County Commissioner Board. Unfortunately, in light of the COVID pandemic, we were forced to cancel last year's 2020 event and also this year's in-person event as the virus still continues to create a risky situation for large in-person gatherings. Instead, we decided we would hold our Senior Health and Fitness event virtually, and we hope to being able to get back together again for an in-person walk in 2022. For this year's virtual event, we've put together a series of short, pre-recorded video clips on topics of interest and importance to our Middlesex County older adult community. Each session is presented by various members of the Middlesex County professional community and guests, as well as by members of partnership organizations that the county works with to address the needs of our older adult community. We hope you will relax and enjoy the seminar and are able to learn and benefit from some, if not all, of the presentations. Enjoy.
Annually, the Middlesex County Office of Aging and Disabled Services holds our annual Senior Health and Fitness Walk for senior citizens in Middlesex County. In looking forward to next year, we hope to be holding the walk once again in Roosevelt Park. So take a glimpse at what's to come. Hope you can join us in 2022.
Exercise is beneficial at any age for a healthier heart, stronger bones, and improved flexibility. And there are some additional benefits for seniors. Regular exercise can reduce the risk of chronic diseases, lower the chance of injury, and even improve one's mood. It is never too late to start engaging in a regular exercise routine. The key is to find something you enjoy.
Right here in Middlesex County, there are some great opportunities to get out in the fresh air and walk. For those in the Edison, Metuchen, and Woodbridge area, check out the Middlesex Greenway, a perfect spot for walking, biking, and jogging.
Welcome to the Middlesex Greenway. This 3.5-mile paved rail trail is ideal for walking, biking, or even jogging. The Middlesex Greenway connects the municipalities of Metuchen, Edison, and Woodbridge along the old Lehigh Valley Railroad corridor.
Greenway is an amazing opportunity to improve community health and to connect the people of the community.
What I like about the Middlesex Greenway is just being out here and having it as a source to come walk, run, ride my bike, and come here with friends, with family.
It's connecting me to the community with other parents that are around my son's age. It's a nice way to exercise without all the cars passing by and having to worry about my son possibly running into the street.
purpose of Bike Patrol is for the public to feel safe. They can come out here with their kids, enjoy the Greenway and what it's meant to be. We're getting out, being proactive, being out on the trail, making sure that people are safe.
The Middlesex Greenway currently extends from Middlesex Avenue in the borough of Metuchen all the way down to just past Crows Mill Road in the Ford section of Woodbridge Township. Plans are underway to further extend the Greenway all the way to East William Street Park in Woodbridge.
It's important to us that the Greenway be connected to shopping opportunities, the downtowns in the area, the transit, the train station, the bus stop.
It's an easy way to get to downtown without going over major roadways. And I know people have used the Greenway, stop at the farmer's market and pick up some fresh vegetables.
Last week we walked over to Edison and went to their farmer's market. Today we're down here in Metuchen's farmer's market. It's a nice community path that everyone uses.
It gets me actually to South Amboy YMCA because I cut through all the way. Sometimes we'll take our dogs there. Access is right down the road there. Access is on Main Street by where we live.
You can currently get on the Greenway at one of 12 different access points spread throughout the 3 municipalities, with many of the access points being fully accessible.
It's been important to us that we have good accessibility as far as ADA. As you can see here with the ramp, we go up and down this all the time.
We like that we can just go for a walk in the evening, and so it's nice alone time.
I liked it so much the first time I came. I shared it with people even in my home country, like Dominican Republic. I'm like, look where I'm running.
I like the Greenway not only because it brings members of the community down to our business and establishment, but also it's a great quality of life to get people off the roads into a traffic-free setting and environment.
It's an asset. It's made living here more enjoyable, and it has those recreational and health benefits that hopefully more and more people will take advantage of.
In August, I'm going to be 88. And I come up and I walk up and down in here. So you have the whole spectrum is here, from children all the way up to senior citizens.
Such an amazing part of the community.
It's a great way to meet people, to exercise.
Well, here it is. The Greenway is here. Enjoy it.
To find out more, visit our websites or follow us on social media.
If you're looking to get out and walk with a group, you should think about looking into the Walk with a Doc program. Local doctors and other healthcare professionals join their patients and other members of the community for scheduled walks to talk about health-related topics while being physically active. For further information about the Walk with the Doc program, you can contact the Middlesex County Office of Health Services.
Hi, welcome to the Walk with the Doc program. My name is Dr. Nrupin Dontineni. I'm a practicing internist and primary care with Hackensack Meridian Health. Today in this Walk with the Doc program, the topic of discussion is vaccination or immunization. Practice of immunization in the United States has prevented hundreds of thousands of deaths, has improved life expectancy and disability. So vaccines are for everyone. Immunizations are not just for children. Currently there are 17 vaccine preventable diseases.
What about women who are expecting? If someone is pregnant, is it safe for them to get vaccinated for any type of condition?
Once a woman gets pregnant, the recommendation is to get a Tdap vaccine against tetanus, pertussis and diphtheria. And a couple of vaccinations that are relatively contraindicated. That means we avoid that vaccine during pregnancy. We usually don't give that, which are the varicella and the MMR. COVID-19 vaccines are very effective in preventing the infection from COVID-19 virus. Lately, there is some concern about the side effects of inflammation of the heart muscle, which in the medical terms we call myocarditis, from the mRNA-based vaccines, which are the Pfizer and the Moderna, but the risk of the side effect is very low compared to all the benefit we get from the vaccine. And with the J&J vaccine, there was a concern about blood clots, which the rate of the blood clots is about 1 in 7 million, especially in women aged 18 to 49. But for people after age 50, the side effect is very rare. So I sincerely urge you, everybody, to get the vaccine against COVID-19. With the flu season around the corner, please do not forget to get the flu vaccine in time. If you have any questions regarding the immunization, please talk to a healthcare provider. Thank you for joining us today.
Falls are a very significant concern amongst older adults. Continue watching for tips on how to prevent falls.
Hey, be careful. You might think you're never going to fall, but we all know someone who has, don't we? Next time, it could be you. The good news is most falls are preventable. Start with 6 easy steps. First, find a balance or exercise program to help you build stability, strength, and flexibility. Make it fun and go with a friend. Don't be afraid to tell your doctor if you've had a fall or are afraid of falling. Ask her to assess your risk of falling. Discuss medications with your pharmacist or doctor. They'll know what prescriptions and over-the-counter medications can increase your risk of falling. Make sure you get your vision and hearing checked every year because your eyes and ears are key to keeping you on your feet. Keep your home safe. For example, remove any items you might trip over. Make sure your home is well lit. Use bath mats in your shower and install grab bars in the bathroom. And finally, remember, it's important to talk to your family. Ask for their support in taking these simple steps to stay safe. Falls are not a normal part of aging, but every 13 seconds, an older adult visits an emergency room for a fall-related injury. Luckily, you can take steps to reduce your risk. Visit ncoa.org/falls prevention to learn more.
Many people suffer from chronic conditions. If you'd like to overcome daily challenges and maintain an active and fulfilling life, keep watching to learn about a chronic disease self-management class available in Middlesex County.
Before the class, like I said, I was depressed. I had a lot of health issues. I was, you want to say, feeling sorry for myself. I didn't know how to deal or help myself get out of the feeling I had.
I think the biggest change I see after someone has attended the class is that they're more empowered to take control of their chronic condition instead of the condition taking control of them. They have a better understanding that it's chronic, that it's not something we're going to fix with a pill or a diet or an exercise, that it's something that they're going to battle their entire life.
There's something in these programs for everybody, and they can be activated at all different kinds of levels, and we can offer them in all different kind of settings.
It's like being with your family, sitting in a living room, talking about your disease, and everybody has the same problem, everybody has the same struggle.
For more than 30 years, evidence-based chronic disease self-management education programs have been empowering healthcare consumers across the country. In small, peer-led classes, consumers learn to take control of their chronic condition symptoms and gain the confidence and skills to actively manage their chronic condition.
The chronic disease self-management education programs are programs originally developed at Stanford University. They are given both online and in person, and they're to help people deal with the day-to-day living with chronic illness. The greatest benefits to people with chronic conditions that take part in these programs is that they have fewer symptoms, less pain, less depression, less shortness of breath, less disability. They also have more confidence in being able to get on with life and do the things that they want and need to do.
In addition to the small group size, classes can be offered in a wide range of languages to remove a barrier for non-English speaking participants. The translations meet required standards for culturally and linguistically appropriate services, often called class standards. They also increase participant trust and connection to the information.
It's not the same thing getting the information in English versus getting the information in your native language. It's completely different because we're talking about two different cultures. For example, I had diabetes, so I have seen dietitians, but in English. Now we're talking about Spanish, we're talking about people that share the same culture, people that eat the same food, that we can talk about how to improve what we eat, and that make a big difference.
In most cases, participants say the group interaction builds a support mechanism they may not otherwise find, activating them and enhancing treatment plan compliance.
因為好多人好似我咁嘅情形嘅，咁我就即係希望佢繼續咯，繼續同埋或者擴大少少，多啲種族可以學習，可以練習。
Research shows that consumers who attend chronic disease self-management programs also tend to work more effectively with their primary care practitioners, reducing time and resources required to manage their care. Program participants become activated healthcare consumers, which reduces healthcare utilization and costs.
The knowledge they gain is incredible. They learn about the disease process, they learn how to manage it. They also learn that they're not alone, that they have support. They can come back with questions to us, which they did after the class, but they also bounce ideas off each other in the class.
Choosing evidence-based CDSME programs to complement treatment plans lowers costs while impacting leading industry performance and quality standards. This includes Medicare star ratings, HEDIS, and primary care medical home metrics.
From a business perspective, even insurers would benefit from this, because if you have better satisfaction with your members and better satisfaction with your providers, you're going to have better outcomes. And if you're a Medicare Advantage program in particular, where you get paid based on patient experience and your clinical outcomes, something called star ratings, this would improve the star ratings of the plan, which could mean, tens or hundreds of millions of dollars if the star ratings improve.
Consumer satisfaction ratings are also positively impacted by participation in the CDSME program. Good news for HCAHPS and CAHPS scores.
Since the inception of the program, not only are we seeing a higher retention rate from our members, but we're all seeing new referrals of members coming to us, and we think a lot of it has to do with the ability to provide them with education that they can't find anywhere else.
The value of offering CDSME in partnership with a community-based organization is seen in many significant risk management outcomes, including valuable time saved teaching self-management skills, recouped value-based payment incentives and avoided penalties, positive impact on key industry accreditation standards, reduced costs of care among high-risk populations, higher member satisfaction, and a more positive disposition toward their providers and health plans.
So these programs provide value to healthcare organizations because it allows the healthcare system to address some of the things that they can't normally offer in a doctor's visit.
Just a more efficient way of providing services, contracting with providers, and delivering a higher quality type of a program for our members than trying to do everything myself.
For providers, the value of CDSME classes is also seen in lower healthcare costs because of reductions in emergency department utilization and hospital admissions and readmissions. Research shows a 3% reduction in admissions and a 5% reduction in ER utilization for CDSME participants. Fewer hospital and outpatient visits means on average a $368 net savings per participant after considering the costs of the program.
So the chronic disease self-management programs, at the end of the day, provide the best opportunity for our members to complete their individual care plan, and by completing their individual care plan ends up with better results, better outcomes, and better overall health of our members.
What I would say to nurse practitioners and physicians and primary care providers is that it makes our job a lot easier when our patients are engaged in these groups. And also it's extremely fun and rewarding.
After the class, I felt like $1 million. I felt like a big weight that's been taken off my shoulder because now I know what I got, what I can do about it, how to deal with it, and how to move on with my life.
If we had a national strategy where people had chronic illness education that was evidence-based using these programs, the healthcare costs in our society and in the country would be much less, and the health outcomes would be much better. So I think this is not just about individual, this really has a ripple effect that really goes up into the federal level in terms of impact.
Mental health is important in everyone's lives. Many people's mental health has been affected over the past year. Please continue watching Commissioner Director Ronald Rios and Commissioner Claribel Ascona-Barber for tips on how to improve your mental health.
The global pandemic has made the past year even more challenging than usual for so many people. We've all had to adapt to new ways of working and learning, and many of us have been separated from loved ones or only able to visit outdoors and socially distance. On top of that, the constant underlying current of concern for our own physical health and the health of our family, friends, and neighbors has taken a toll on our mental health. It's always important to be aware of and take care of our mental health, but especially during such a stressful time as a global pandemic. That's why today I'm pleased to welcome Commissioner Claribel Ascona-Barber to share some tips from the George Otlowski Center for Mental Health. Let's take a look.
As the director mentioned, I am Middlesex County Commissioner Clary Ascona-Barber, and I'm happy to share some practical suggestions from the mental health professionals at the Otlowski Center. As one of the last community mental health facility in the state of New Jersey, the Otlowski Center has found the services even more in demand during the pandemic, in part due to the high number of people who don't typically suffer from mental health issues reaching out for help. The Otlowski Center recommends 5 simple things we can all do to support our mental health during this difficult time. Tip number 1, find time to disconnect from your day-to-day life. This includes simple disconnecting from our devices, as the pandemic has forced everyone to be connected to their devices. Instead, read an exciting book. Take a walk in the park, maybe a park you haven't been to before or one you haven't visited too many times. Try out a new recipe or even start coloring, anything to break your routines. Tip number 2, try to connect with family and friends any way you can. Distance makes the heart grow fonder, but not during a pandemic. It's important to find new ways to connect with your family and friends. So, if you have Zoom fatigue, try writing letters or sending postcards in the mail instead. Writing letters, it is a lost art, and the anticipation of receiving letters is exciting. Tip number 3, avoid social media. I know this one may be especially difficult, but social media can be misleading. Not only because people often post exaggerated lifestyles, but also because fake news and rumors are everywhere on most social media sites. During this COVID-19 crisis, it is imperative that we get our news from information from credible sources, such as major newspapers, so that we can stay educated and in control. Tip number 4, set clear boundaries from work. Working from home can be convenient and it has helped keep employees safe. But it is also made lines between work life and home life unclear. This has left many people feeling as though they always own. So it's key that as workers, we set boundaries, making a clear break from work by shutting down our work-related technology, if possible. At the end of the day, work, and then begin our home life. And the final tip, treat yourself. The pandemic has asked a lot from us, from helping elderly loved ones to homeschooling, just keeping it together on a daily basis during the worst public health crisis in a century. All of us have been asked to give more to ourselves during this time. That's why it is important to focus on self-care. Self-care can come in many forms, whether it's doing something nice for yourself, like relaxing in a bubble bath, enjoying some online shopping, exercising, just getting some alone time, or taking care of your health by visiting doctors for regular checkups. Thinking of yourself and making time for self-care should not be confused by being selfish. And there you have it, all practical tips for helping your mental health. Thank you to our friends at the Alaska Center for sharing these suggestions with us. These are small things that we can all do to give ourselves a little mental health break during this stressful time, or any time, really. I personally do some of these things from time to time when I need to relax and escape the stress of daily life. I hope you will consider giving some of them a try in your own life. Thank you. Muchas gracias.
Mental illness and addiction touch everyone. People with mental health illness and addiction can recover with appropriate support and services from the community. However, many avoid seeking help due to the stigma surrounding mental illness and a fear of discrimination. We can help. Each of us can do our part to help end stigma and support those who are dealing with mental illness and addiction. One way to do that is by joining me in taking the pledge to end stigma. If you would like to show that you stand with those impacted by mental illness and addiction, go online to www.middlesexcounty.gov/stigma pledge. We all need help sometimes. Join me in showing support for people affected by mental illness and addiction. Take the proper pledge today. That's our show for today. Once again, I would like to thank Commissioner Escona-Barber for sharing those helpful tips from the Atlowski Center for Mental Health. And thank you for tuning in for this month's episode of Spotlight on Middlesex County. As always, more information about the topics we discussed today can be found on our website at www.middlesexcountynj.gov. On behalf of the Board of County Commissioners, I hope that you and your families are staying safe and healthy. Please continue to follow all safety recommendations regarding COVID-19. We'll see you back here next month with a new episode of Spotlight on Middlesex County.
Malnutrition is an invisible epidemic that can lead to various health concerns. Seniors are one of the most at-risk groups for malnutrition.
We hear about malnutrition in the world news, but it's not just a problem in other countries. Malnutrition is a hidden epidemic in the United States that is under-recognized and under-treated. Malnutrition occurs when the body doesn't get the right balance of nutrients and calories that it needs to stay healthy. This doesn't just happen to people who suffer from hunger or who don't have access to healthy food. Malnutrition can happen to anyone. So, who is at risk? Older adults are at an increased risk because as we age, our dietary needs can change. Our sense of taste and smell may weaken. Digestive systems may slow. Chewing or swallowing problems may develop, and the ability of our bodies to absorb nutrients can decline. People with chronic disease are also at risk. These diseases can reduce appetite, make it physically difficult to shop, cook, and eat. make it hard to remember to eat, and change metabolism and digestion. And their treatment and management can require dietary restrictions, as well as medications that cause appetite-reducing side effects. Malnutrition can lead to hospitalization, and hospitalization itself puts people at risk. Surgeries and other procedures may require that patients follow restricted diets or not eat. Illnesses and procedures can decrease appetite, and people may eat less because they don't like their food choices or are worried or depressed. This can all happen at a time when people may need more nutrients than usual to promote healing and recovery. Living in a nursing home or other long-term care facility also raises risk. Residents are more likely to have multiple chronic diseases and conditions that complicate nutrient needs and the ability to eat. They may also be socially isolated or depressed, lack interest in food, and depend on staff for help with eating. The consequences of malnutrition are serious. Without proper nutrition, our bodies can't stay healthy, fight off disease, or deal with illnesses that we already have. It weakens our immune systems and leaves us vulnerable to infections and slower recovery and wound healing. It also causes weight loss and muscle loss that can lead to frailty, falls and broken bones, disability, loss of independence, and complication of other diseases. Disease-related malnutrition is often associated with protein deficiencies, which can result in loss of muscle mass and strength. This can be very serious and cause or worsen sarcopenia, the progressive loss of skeletal muscle with age, and the consequences are far-reaching. Malnourishment while hospitalized often leads to longer stays, higher infection rates, higher hospital readmission rates, worse outcomes, and death. And the increased economic burden in the U.S. for disease-associated malnutrition in older adults is more than $51 billion each year. Thankfully, malnutrition can be treated. Involving the whole healthcare team in treatment is vital and may include treating the underlying cause of malnutrition if possible, changing the diet to work around restrictions or provide foods with more calories and protein, offering social services like in-home support, meal delivery, community-based nutrition programs, and access to food. People with disease-associated malnutrition or in hospitals or institutions may take oral nutrition supplement drinks for easy access to needed nutrition. In some cases, tube feeding or IV nutrition is necessary. With malnutrition, it's important to remember that people of any body size or type, even those who are overweight or obese, can become malnourished, so it's not the weight alone that counts. Healthcare professionals may not always recognize the signs of malnutrition. The symptoms may be subtle and may be dismissed as a normal part of aging, so start the conversation if you or a loved one experiences sudden unintended weight loss and/or loss of appetite and decreased food intake. Those are the two main symptoms, but people who are malnourished may also experience other symptoms. Request a consultation with a dietitian to be sure that you are getting enough nutrients. If you have a chronic disease that impacts your nutrition, have regular discussions with your healthcare team about your nutritional status. And be sure to ask for a nutrition plan before a hospitalization so you can make sure you don't lose weight during your stay. Discuss a nutrition plan for home before your discharge so you don't lose weight during your recovery. The hospital dietitian can help you connect with community nutrition programs, such as home-delivered meals and nutrition counseling. For more information, visit the following organizations online and visit the Alliance for Aging Research at www.agingresearch.org/malnutrition.
It's very important to be prepared in the event of an emergency. Continue to watch the next clip for tips on emergency preparedness.
Being prepared for an emergency is important at every age. As an older American, you may need to think about taking some specific steps as you get yourself prepared in case of a disaster.
As people age, their needs change and their capabilities change. So in preparing for a disaster, it's important to think differently than you might have at earlier ages. Preparing for an emergency is very empowering for older adults because it gives them the opportunity to identify what they need and ensure that they'll have those needs met when a disaster strikes.
Take a few minutes to check out the Ready.gov website, which features specific tips and tools for older Americans. There are a few basics. First, learn about the types of risks that could affect your area. Then, make a plan. You can use the Family Emergency Plan available on Ready.gov to organize and help you develop a plan that works for you. Create a personal support network if you need special assistance during an emergency.
A personal support network is very important for all Americans, but especially for older Americans. It can include your family, friends, neighbors, doctors, organizations, places where you worship, places where you do activities, and just making sure that those people know what your needs are in case of a disaster.
Let the people in your personal support network know what medicines you rely on, and if you have any physical limitations.
For older Americans who receive services such as home health care or receive regular medical treatments, it's important to reach out to those service providers ahead of time and communicate to them what your needs are, and also to understand what their emergency plans are in case of a disaster.
Identify someone locally and someone out of state who will be your contact person in case of an emergency, and learn how to send updates via text messaging to your friends and family.
One of the things that we've noticed in the past during major emergencies, both the regular phone lines as well as the cell phone lines were overwhelmed. But people were still able to text message vital pieces of information in terms of location, nature of problem, or just to text to say all is well.
Once you have a plan, prepare an emergency kit. A standard emergency kit includes food, water, and medicine to sustain all members of your household for at least 3 days. Visit Ready.gov for a complete list of suggested items, along with recommendations for how to prepare a family emergency plan. Pay particular attention to certain things, like making sure you have enough of any medications you take, an extra pair of glasses in case one breaks, or extra batteries for hearing aids.
It's important to remember that certain things such as medicines can go bad and spoil, so just make sure that what you're putting into your kit is not expired and check it on a regular basis.
If you are unable to obtain an emergency supply, be sure to always fill your prescriptions on the first day you become eligible for a refill, rather than waiting until the day you run out. Keep copies of important documents like birth certificates, insurance policies, Medicare cards, and financial forms in your emergency supply kit. Also consider placing electronic copies of this information on a portable flash drive. This could be useful for others even if you don't personally use a computer. For those who depend on the mail for their Social Security benefits, switching to electronic payments is one simple, significant way people can protect themselves financially before disaster strikes. Federal benefit recipients can sign up by calling 800-333-1795 or at www.godirect.org. A disaster can occur at any moment. By making the commitment to prepare yourself ahead of time, you'll have the peace of mind and confidence needed to get through any emergency situation. Check out the information for older Americans on Ready.gov and get started preparing today.
We hope you enjoyed our virtual Senior Health and Fitness seminar and learned some new tips on how to improve the quality of your health and wellness regime. For more information on programs and services available to older adults and disabled residents living in Middlesex County, visit the county website at www.middlesexcountynj.gov. We hope that we'll be able to see you in person next year. Enjoy the rest of your day.